So, but I am the same person. And as I mentioned in that talk, I'm a dental student. So this is more similar to what I learn, while I'm at university. And today, the point of this talk is to kind of look at the differences between medicine and dentistry, see how they kind of contradict each other sometimes, and then look at what we could do to work towards them being more collaborative for the benefit of the patient. Okay, we've got a lot of stuff in the chat at the moment. I'm seeing a few things that I'm actually going to mention. So there's some people that obviously have been doing their research, which is really, really positive in terms of being prepared for things like applications and interviews. So this is really great. What we're going to do today is we've got a presentation to go through. I'm going to touch on quite a few different topics. And then at the end, if anybody's got any questions, I will work through a few of those. They might be more towards dentistry itself or to do with the topic of the presentation. So I think we'll probably make a start fairly soon. There are a few people that are just coming in now. But what I'll do is I'll start on a little bit of an introduction, and then I think people will, as many people as we're gonna get will be in by then. Okay, so am I okay to start now?
Yeah, I think go for it. I think 70 is as much as we're gonna get. Second talk on a Sunday evening. I think let's go for it.
Fantastic. Okay, so as I mentioned, I'm a dental student, so I'm a first-year dental student at the University of Leeds. Kind of relevant to this talk, I did actually consider medicine before dentistry, so that was my first goal when I was in sort of year 10. I was working towards getting into medicine. However, as I did mention in the previous talk, I discovered that I actually did have quite an interest in dentistry. So that's what I started pursuing from start of year 12. Some of my interests in dentistry include dental anxiety. So I mentioned again earlier that I was thinking about integrating psychology because that is a massive part of dentistry. I'm also interested in oral surgery from some work experience that I did before I actually started dental school. Somebody mentioned that oral and maxillofacial surgery can often be done by practitioners who have a medicine and a dentistry degree, which is very true. Something I have considered, but obviously it is a very large commitment to undertake both, really long taxing degrees. So something to think about in the future. And another one of my real interest in dentistry is the socioeconomic factors that affect oral health. So this is something that I think I might be mentioning in a future talk, about how, where you live, your economic background, your family attitudes can really affect your outcomes in terms of oral health. So we're going to start off by thinking about what we do agree on, because obviously health professionals have to work together. It's part of the GD principles to work with a team to have the best outcomes for patient. Obviously that's within dentistry, but the value applies, across the board. There's a big focus at the moment in the UK about choosing the most appropriate service for the issue that you have, and also not going straight to maybe a GP or A&E for an issue that could maybe be remedied somewhere else. So in terms of what we agree on between medicine and dentistry, the first one that I've put, could be debated to be the most important, is this patient-centered care. So both dentists and doctors are working in the best interest of the patient for the best outcome for the patient. So if you guys have been looking into your medical ethics, you'll know that you really have to give your patient all the options that are available to them. And you also have to let them, have the final say in their treatment. As a professional, of course, you will have lots of knowledge and you might have an opinion about which is the best treatment. However, at the end of the day, it's the patient's decision, and they can choose to, pick an alternative treatment if it's appropriate, or they can choose not to have a treatment at all. So that applies to both medicine and dentistry. The second thing that is in common between both professions is evidence-based practice. So despite them, working in different areas, they're both working from this, peer-reviewed, evidence-based background. They're not just deciding what they think is best. They're really working from their training, which Obviously, we know there are differences in training, but this training is again both based on the evidence that has been thoroughly researched and shown to be the best practice. Another similarity between medicine and dentistry is this foundation in basic sciences. So sometimes when I talk to medics, they're surprised to learn that we're actually covering a lot of the same content that they are in first year. We have a really strong foundation in things like anatomy, pathology, physiology, microbiology, immunology, pharmacology, lots and lots of very in-depth study into these topics because they are applicable to both. If somebody gets an infection, that's relevant to both professions. So I think it's really important to emphasize that dentistry, maybe against popular belief, still does have this foundation in the entire body. It just then focuses in on the head and neck rather than staying as being, knowledge of the breadth of the body. This kind of links to the patient-centered care, but there's also ethical practice at the forefront of both a doctor and dentist mind. So again, linking to things like consent, confidentiality, following the pillars of medical ethics, following the GDC principles, they all come back to treating the patient with respect and dignity and letting them make decisions about their own care, making sure that their information is protected, making sure you're working with your team for the best outcome for the patient. Specific examples of ethical issues may differ between the professions, but the foundation ethical practice is the same across both of them. Both professions also agree that, you should live this healthy lifestyle. Both of them give advice on diet, on drinking alcohol, on smoking, about self-care, about, proper sleep. Sometimes they're giving advice on those things for different reasons, but they still have that outlook that, patients should care for themselves holistically and not just, reacting to having an injury or an illness. They should be trying to constantly maintain, the most optimum state of health for themselves. And then something that I've been quite interested in recently is there are significant developments in, over history that have affected both of the professions. So the main two ones that I considered were development of anesthetic. So anesthetic is really, really useful in terms of dental practice. So most times when patients have any treatment done at a general dentist, it will be under the local anesthetic by injection. So development of anesthetic have been really significant to dentistry. It's also very widely used in medicine for surgeries, but also, topical anesthetics are really a great tool for doctors to be able to have. And then also the development of antibiotics. So starting off with the development of penicillin in 1928, it's very applicable to both professions because, there's a lot of talk about antibiotic resistance. However, on the flip side, antibiotics are often one of the first considerations a dentist and a doctor might have if a patient is presenting with, signs of infection, having like inflammation, fever, things like that. They will often both go to antibiotics to try and sort of remove the bacteria that are causing, the issue for the patient. So there is a very, very strong foundation that both doctors and dentists rely on. This strong scientific basis, evidence-based, and treating patients in the best way possible. So next, I'm going to touch on the history of medicine and dentistry, and this kind of gives us a little bit of an insight as to why they are separate professions. So I'm going to start off with medicine because that kind of came first. Everything that happened in medicine then ended up happening to dentistry, but it was medicine that came first. So we know sort of outside of the UK, we have influential people who weren't, technically medics, but they had a massive influence on how we work with medicine and with patients. So people like Hippocrates, Galen. In the UK, there's Louis Pasteur who came up with germ theory, John Snow, and thinking about cholera and waterborne diseases. There were quite a few prominent figures that are involved in creating medicine as we know it today. So the Royal College of Physicians was formed in 1518, which is quite a while ago. And the Royal College of Surgeons was granted a charter in 1800. Later, in the next slide, I'm going to talk about how dentistry as a career developed, and we can see that everything happens a little bit later. And in 1858, the GMC was established, the General Medical Council, and there was a national medical register for doctors. And it said in that medical act that it's expedient that the person requiring medical aid should be able to distinguish qualified from unqualified practitioners, which, I'm sure we can all agree is very, very important. So this medical act in 1858 meant that you could only practice medicine if you were, trained and qualified. So thinking about how medicine has developed, through history to present day, at the moment, well, in present, medicine is a lot more of a collaboration with the patient. Throughout history, it might have been more, the doctor says do this, you have to do this. Whereas now, the doctor can suggest the best options for the patient, but ultimately it's the patient who gets to decide what happens and, help build a plan for their care. Moving on to dentistry. So in the UK, dentistry originated with these barber surgeons who had varying skills, but they were untrained. They didn't have a sort of formal qualification. If you're, looking to do some further research in your own time, I would really recommend looking into dental appliances from other countries and other civilizations. If you look at sort of ancient Greece and ancient Rome, they were, had some very, very very, very modern seeming dental appliances compared to even what we had a few hundred years ago. So that's really interesting if you want to look into it. But just focusing on the UK, there wasn't really that much focus on dentistry. The focus was on medicine. And then this guy called John Tombs came around, and he actually started out as a medic, but he was doing some microscopic research on teeth and thought, actually, I think I quite prefer this. So he switched to, trying to learn about dentistry instead. And he's kind of really been influential in that period of developing dentistry into its own profession. So he established his own practice in 1840, and then he started lecturing about dentistry in 1845. And then he was the one who ended up producing the first dentistry textbook, essentially, to sort of share that information that he'd learned through his career with other people. He formed the Odontological Society of London in 1856, which was a group of about 90 dentists initially. And they sort of agreed that they needed to regulate the number of, not the number of dentists, but who can identify as a dentist, because there were still sort of these barber surgeons who were untrained and, causing great risk to the patient. So they got this they made a qualification to learn how to be a dentist. And then this developed into having an association with the Royal College of Surgeons. And then there was legislation that was made so that only dentists with training could call themselves a dentist. That was in 1878. And then even though the GMC was established way back, the GDC was only established in 1956. If you think about that, that's less than 100 years ago compared to medicine. So there's really a great difference in the progression of the two careers. So it's surprising, actually, that they're kind of on par with each other in terms of development and treatment when one's been around significantly longer than the other. I think dentistry's had to make some quite large gains to get up to speed with medicine. I think it's just a sort of fun fact for you. So John seems to have mentioned quite a lot in this slide. He's actually sort of, his dedication to dentistry is kept alive through his involvement in naming many of the processes that we learn today. So this is something that actually I learned when looking to make this presentation, because I'd heard of the Tombs process, which is something we learn about in the formation of enamel. And I found out that actually it's because of him and all the work that he put into making dentistry sort of a qualified and regulated profession. So that's really interesting. So in terms of how dentistry is developed to present day, it used to have its main focus on removing teeth and, preventing pain or resolving pain. Now dentistry has really progressed onto a very preventative profession. There's a massive focus on prevention education. And there's also a very big focus on aesthetics. That's something that you guys, if you're wanting to go into dentistry, you probably have seen because it's quite prominent in the news as well as prominent in terms of suggestions for interview preparation. But like I said, it's very interesting to see how quickly dentistry has had to develop compared to medicine.
Thank you so much, Charlotte. If just before we go on to the next one, I was wondering if we make sure these guys have a chance to kind of recap it all. So, some brilliant ideas we've got about kind of the historical side of things. If I was to give you a question to have a think about based on that, so the people in the chat, make sure you're all awake. If we have a think about what might be the changes in dentistry over the last 100 years, if I ask one of you to maybe volunteer, let's give this a go. What do you think might have changed in dentistry over the last 100 years? And what do you think might be changing in the next 20 or 30? So, what might have changed over the last few decades, and what might be changing in the near future? If that's our interview question, and I'm not expecting you guys to know like a perfect answer at this stage, but let's see, do we have any volunteers who might want to put their hand up and give that a go? So, how might dentistry have changed, and how might dentistry be changing in the future? And Charlotte has given you some brilliant ideas. So, does anyone want to give that kind of question a go? And you get some feedback afterwards. What do we think? Any volunteers? Or if you want to put your thoughts in the chat, what kind of things might we have seen changing, and what kind of things might change in the future? Yep, so we've got more aesthetic work.
I
In the
think
future,
dentistry has changed a lot with technology such as AI diagnoses, which kind of like speed up treatment diagnosis and like the accuracy of it.
yeah, definitely. And what do you think that could mean for patients? What could change?
It could change like the waiting times they experience, and also like it could help them save money so that like they're paying for the right treatments rather than the wrong treatments, then having to pay again to get the correct ones.
Potentially, for sure. So AI could potentially help with diagnosis, and that could mean that the likelihood of getting an incorrect treatment or the likelihood of being treated unnecessarily is going to go down. So your treatment might become a lot more personalized. And I guess this would be something that would fit into your category of maybe over the next 20 years. What kind of things are going to become more and more significant? Well, we're thinking about something like the use of AI, treatments becoming more personalized, treatments becoming more specific. So, the kind of things you might want to talk about, if we're thinking about over the last 100 years, linking back to all of the things that Charlotte's been mentioning, you might want to think about, say, pain management and anesthesia. So, it's becoming maybe a lot more effective. We've got conscious sedation now. We have local anesthesia as an option that we didn't used to have 100 years ago. So, we've got big improvements in pain management. We can talk about kind of infection control. So we're a lot more sterile in the kind of instruments we use. We use disposable sterile tools to make sure we don't spread infections. And we have kind of widespread use of antibiotics where necessary. The kind of things we do for diagnosis. So we might be using 3D imaging, digital x-rays. We've got specific cameras that can go inside the mouth, intraoral cameras, all this sort of thing, very new. The kind of stuff we're using to do fillings. So think about the kind of materials we're using. That's going to be quite different. In the past, we were using stuff like amalgam, and that's now switching to maybe something like composite resins, porcelain crowns, because there has been kind of the whole scandal of how amalgam may not necessarily be the right sort of approach. We've got a huge focus on cosmetics, orthodontics, so kind of the more cosmetic side of dentistry, not just maybe treating pain and cavities. And probably the biggest one that's really important to mention is the idea of preventive dentistry. So it's not just patients coming when something hurts, but preventive visits, fluoridation of water, sealants, education, and the big part of the dentist in educating his patients. So not just providing treatment for, say, cavities, but making sure you're providing guidance from a very early age to make sure children, adults can maximize their dental health. And if we're thinking about the future of dentistry, definitely AI and automation. So think about how that can make diagnosis more accurate, how that can maybe assist with admin, routine procedures. Think about maybe the regenerative side of things. So how we can help with things like stem cell therapies and how that could maybe improve with tooth regeneration, that side of things. You can also talk about maybe genetic dentistry. So how we can maybe use a patient's genetic factors, genomic data, how we can predict risks, risks of maybe cavities, risks of gum disease, how a specific patient, based on their genetics, is most likely to respond to a certain kind of treatment. And finally, you might want to talk about kind of how under COVID-19, the idea of remote monitoring, virtual consultations, and teledentistry. So how that sort of thing might be doable remotely in the near future. So have those two side of things, what's happening new and what's changed over the last 100 years. And that should give you a really good idea for maybe how dentistry has been evolving. So if I let you move on, Charlotte, hopefully they had a chance to share some of their thoughts as well.
No, that sounds great. I think there's some really important things to consider there. I would just point out that so I think it's really great that people are sharing their opinions in the comments. I think this is a really good space to do that if people want to try out saying something based on the topic. It's really good preparation. I would just maybe say to people that if you're going to pick specific terminology, it's really important. This is advice for going forward to an interview. At this point, it's completely normal and understandable. People might be quite unsure what certain words mean. I always think that if you're going to use a specific piece of terminology, it's really important to look into that and make sure you have an understanding, because sometimes, admissions officers and interviewers are on the lookout for people who drop a load of words in, but then on further inquiry, they say, what's teledentistry? And then the student, gets a bit unsure. So I really encourage you to look into these topics and, do some research, and it'll really, really reflect in your interviews that you've, gone under this further study, and it'll really be very beneficial for your chances of getting a place. So in terms of moving on with the presentation, I'm just going to briefly talk about the scope of medics versus dentists, because I think that's something that's good to establish before we move on to the differences in practice. So the scope of a dentist is mostly the oral cavity and associated structures. So, the head and neck, teeth, gums, tongue, lips, jaw, TMJ, which is the temporary mandibular jaw, a joint, which is like here. Whereas a doctor, especially a general, a GP, I think a lot of this is focused on a GP because it'd be very difficult to compare dentistry to all the different medical specialties, because there are obviously very many of them. They have the focus on the entire human body and its systems. So it's very focused on holistic bodily and systemic health. So the thing to think about is that medicine has a very broad scope, lots of broad knowledge, whereas dentistry is a very deep knowledge of a very specific area. Of course, if you look into specialists, for example, we were talking about gynecologists earlier, they will have very deep knowledge of their subject. But in terms of things, comparing a GP and a general dentist, there's a difference in the type of knowledge that they have. I've mentioned here the Dentist Act 1984 and the Medical Act 1983. These kind of define and further define. Oh, something popped up on my screen there. Sorry, I apologize. These are quite important things to be aware of. These medical acts and dental acts are something that I think would be worth looking into. They're not often thought about at interview, but I've been having a quick look into them to see if I can find some comparison points. I think they would be valuable. So, in terms of, beyond just, a dentist surgery and a GP surgery, there's differences in sort of public health focus. So if you've prepared for a dentistry interview, or you've thought about preparing for a dentistry interview, you probably will have heard about water fluoridation and the sugar tax. These are things that have had quite a significant impact in the areas that they are in. A lot of common misconceptions that the sugar tax didn't actually have an effect. However, if you look into the research it actually, there is a relationship between the sugar tax and a decrease in hospital admissions for children from having these having dental issues. So it is something good to think about. In terms of common or commonly spoken about medical public health programs legislation, obviously we have vaccine programs, vaccine rollouts. If you think about smallpox, that was declared as being eradicated in 1980, which really shows upon the positive benefits of that. In terms of smoking legislation, that's something that's relevant to both professions. I actually talked about this in one of my first year presentations. Smoking legislation is something that's quite good to keep up to date with because it's constantly developing. So at the moment, the most current legislation is the tobacco and vapes bill. So people might be aware that I think in the past week or so, disposable vapes have been banned, which is primarily because of waste in the environment, but also it's because a young person is more likely to pick up a disposable vape because it seems like less of a commitment. So I would recommend that if anyone's looking into sort of further research, further reading. There's a lot of targeted intervention in dentistry, and that's because of this sort of really strong relationship with socioeconomic factors. Again, this is something I think I'm talking about in a talk later on this month. And if you've ever talked to maybe an older relative and you ever mentioned dentistry, they might say to you, oh yes, we used to have a school dentist or a school dental nurse, and we don't have that anymore. So maybe that's something that we could think about might be worth considering. Because again, if you keep up with the news, there's talks about supervised toothbrushing in schools. So maybe this is something we're sort of going back to. A difference is really the a doctor or a medic's focus on exercise and fitness. So I talked about healthy lifestyle earlier, but exercise and fitness is a lot more relevant to medicine or to a doctor than a dentist. So they will emphasize that more. There's sort of public health campaigns, adverts on television about getting involved in exercise, which is really important. And in terms of COVID, obviously COVID impacted every area of life and every profession, but it was a lot more important in medicine in terms of solving the problem. Nobody was looking to dentists to find the cure for COVID or find vaccines. That was really focused on medicine and on doctors. And I think it's something to really be aware of, that it was doctors and scientists who had to deal with a pandemic and do it very quickly. So I think we can really use that as an example of, first of all, a vaccination program that was developed very quickly, but also how we have to be aware of things like public health, because there come times in history where it's really, really prominent and really important to everybody, not just people going to a doctor. So on to the main question, which is, why can't we agree? Why is there such a contrast, and why do we have such different focuses? So I'm going to talk through a few different examples today of things that either we directly contradict each other on, or we just seem to offer advice in a certain area, but we don't touch on the other. So something that is really prominent, and I think somebody also already mentioned in the chat, is about diet and how medics and dentists give advice on diet. So I'll start off with medics, because I think the thing with diet advice is it's gone beyond just being a doctor's responsibility. If you go on social media, there's always people saying you should eat more protein and eat less of this and take this multivitamin for great benefits. So really, diet has moved beyond just being a medical health issue. However, in terms of the advice provided by doctors, there is a really, really big focus on this balanced diet. So having fruits, starchy foods, dairy, protein, small amounts of fat and oils, and also staying hydrated through drinking water, milk, tea, or coffee. So this is good holistic advice. In dentistry, the focus really is on a low sugar and a low acid diet. And there's really a significant point about extrinsic and intrinsic sugars. So this is why maybe eating an orange or an apple is good. But if you drink a fruit smoothie, your dentist probably wouldn't be as happy with you. So an extrinsic sugar is a sugar that's not contained within the structure of a cell. So they're also called free sugars, and they're the ones that will cause damage to your teeth. And the reason why we're trying to have a reduced acid diet is to minimize the acidic environment inside the mouth, because that can cause the proliferation of, I've written, karyogenic bacteria. So that's bacteria that are most or more likely to cause caries or cavities in the teeth. And this is a bit different to why doctors and medics will promote the diet, because their main focus, and obviously there are more specific focuses for different people, but the main focus is, you know, maintaining a healthy weight. There's a lot of different advice, which is quite tricky with this one, even in just what you should drink. So you might notice that, you know, medics and doctors might say, you know, drink lots and lots of drinks, 6 to 8 cups, water, milk, tea, coffee. If you ask a dentist, should I drink 6 to 8 cups of tea or coffee a day? They'd say, please don't do that, because their focus is on the effect that they can have on your mouth. First of all, coffee is acidic, which is not good for the environment, the oral environment. Second of all, they can stain the teeth, which is more of an aesthetic concern than a health concern. However, it's still a concern that a patient will bring to a dentist and ask them to resolve. And the final sort of point of comparison is how a dentist versus a doctor will measure the success of a diet. So a dentist would observe whether the diet is working for the patient through looking at the teeth, and making a DMFT score. So this is a score that measures the number of decayed, missing, or filled teeth. You might often see it in research, and it really gives good quantitative data that you can compare between patients, and then sort of on a population level, which is really helpful. Contrast that, a medic might look at whether someone's diet is effective primarily through things like BMI, waist to hip ratios, seeing whether somebody's size or weight is where it should be, or through progression of an existing disease. So if somebody has hypertension and they've been advised to have a low sodium diet, you can observe whether that's working through measuring their blood pressure. This also applies with things like elimination diets. So for allergic conditions, it can be helpful to have a specific diet for that, and that'll be measured by the progression of the disease. So somebody actually mentioned this in the chat. I was quite impressed that that very, very early on somebody had grasped one of my main points. But I'm using the example of orange juice. So from a dentist perspective, orange juice is not really recommended. If you're this kind of the opinion, if you're going to drink it, dilute it, have it at a meal time, because it's highly acidic and it has a high sort of proportion of extrinsic sugars. This is a concern for a dentist because it's going to contribute to erosion of the teeth because of the high acidity. However, from a medic's perspective, they're aware that maybe it's not best for you in terms of sugar, but they see a lot of benefits in it. It's advised as a form of constipation relief. So I talked to a lecturer at my university whose son had been recommended it by a health visitor. So as a dentist herself, she was not entirely impressed by that advice. But of course, a health visitor or a doctor, their main priority is overall health. They're not focusing on the oral cavity like a dentist is. Another point is that it's got vitamin C. So making sure that children and young people are getting all the vitamins they need. It's a good way to integrate that into an average diet if somebody's not wanting to just take a multivitamin or something like that. There's also a good point to bring up in terms of the sugar argument, is even the way that both professions view how you should consume sugar. So from a medic's perspective, you should consume sort of low amounts of sugar, just overall in your diet. However, from a dentist's perspective, if you have 100 sweets but you eat them all at once, that's fine for a dentist. They'll be like, absolutely great, go for it. If you go and see a dentist after sort of Halloween or Christmas or another celebration where you're being given lots of sweet things, they'll say, just eat it all at once, you'll be fine. because for dentists, the main concern with sugar is the frequency. Because if you think about maintaining that, optimal environment, every time you put something acidic there, the acidity will increase, and then your teeth can't repair themselves as effectively. So if you eat it all at once, then you're fine. Whereas it's kind of for medics, if you're eating sugar, they're more focused on lower quantities of sugar, because eating loads of sugar isn't good for, it's high in calories, it's not great for your health. So even when they're both recommending against sugar, it's still for different reasons. So a brief point here about just even getting an appointment with professionals. There's different outlooks. Oh, I might erase. So I'm just gonna try and erase some of these. Thank you very much for that. Okay, so from a general dentist compared to a general doctor. So with a general dentist, if you've got an NHS dentist, you will have routine appointments whether you've got a health issue or not. And once you see the dentist, they will say, come back and visit me in 3 months, 6 months, 12 months, regardless of whether you've got a problem. Because of this, they're mostly scheduled appointments. And this also means that they have variable appointment times. The dentist can think, okay, so your next appointment, you need a root canal. I want to see you in 2 weeks, and it's going to take me an hour and a half. So it can be scheduled in. A lot of treatments can be done on the day within the appointment time. To contrast that, with a GP, you're mostly only getting an appointment if you want one. If you ring them up and say, I have this specific issue, I'd like to speak to a GP, please. They're mostly focused on immediate need. So you're not booking a GP appointment 6 months in advance, because there's no need for that, from a doctor's perspective. And we can probably see why this is quite helpful, because at the moment it's really tricky to get a GP appointment, even if you do need one right now. So for people booking them months in advance, that probably would exacerbate that problem. Under NHS GPs, there's quite a limited appointment time, so you can have a double appointment. However, you can't really, because you can't plan it in advance, you can't plan for the amount of time that you need, which can be difficult for patients or for doctors if they're trying to resolve an issue, but they're on sort of a strict time limit. And if your doctor says you need this treatment, instead of in a dentist where they'll be like, okay, you need a filling, I'll do that for you now, you're probably going to arrange for it to happen by the GP or by a different practitioner. It's unlikely to be able to happen on the day, just because of how time pressured the appointments are and how busy the practice might be. So there's a difference there. In terms of preventative advice, so preventative advice in dentistry is integrated into the appointment, and it's expected at every appointment. It's a large portion of what the dentist is talking to the patient about through the appointment, and it's really important for dentists to be providing this oral health information at every time they see a patient. They're really encouraged to give personalized advice. So in terms of things like recommending a toothbrush. So if you have a patient who's got very poor oral hygiene, you're aware that they come from, a struggling economic background, you wouldn't be saying, go and get the newest Oral-B electric toothbrush. You'd say, did you know that you can, go to Asda, there'll be toothbrushes in there for £1. I'd really recommend that. If you have maybe a patient who's better off, you can say, you can have a manual toothbrush, these are the options for electric. So it's really focused in on the patient. From medics, it's tricky, because ideally, I'm sure a general practitioner would love to give as much preventative advice as possible. However, they have to kind of use the opportunities that they have to give advice that's relevant to the complaint or the patient themselves. So because GPs have this wider scope, if they were to give preventative advice relating to the whole breadth of the body, they'd be there all day. So they give a lot of advice relative to the condition, but they're not giving advice on how to prevent other things that aren't at the forefront of the patient or the practitioner's mind. But they do, however, encourage to check in with health measures with other professionals. So for example, you can go to a pharmacy and get your blood pressure checked. If you go to the pharmacy and get your blood pressure checked, it's high, you can get a blood pressure monitor. There are options out there. They're just not always within the appointment. So this is quite a filled up slide, but I will try and talk through it in a way that's helpful. So somebody mentioned, I think, about being able to well, they said the diagnosing disease. So I would point out that a dentist probably, they can identify that their symptoms of the patient might be aligned with the disease. However, they wouldn't be diagnosing things like diabetes. They would be passing it, recommending the patient see their doctor, and then I think the GP would take it from there. However, it's really, really interesting to note that these conditions that I've written about here present orally as well as in the rest of the body. So a big one is diabetes. So, you might think, what are the symptoms of diabetes? Increased thirst, frequent urination, fatigue, things that you're maybe looking out for in your life, or you've heard, oh, this is what happens when you have undiagnosed diabetes. However, a lot of people don't know about how diabetes presents in the mouth, and often diabetes can be identified first by a dentist just because the patient doesn't realize that they have it. So some of the ways that a dentist can identify it is periodontitis, so really severe inflammation of the teeth and, well, not the teeth, of the gums, large pockets, bleeding when they probe, things like that. I've written xerostomia. So xerostomia is the word that we use for dry mouth. So that can really be caused by diabetes. There's also increased susceptibility to oral candidiasis. So this is also called oral thrush. It's sort of these white patches inside the mouth that can be indicative of diabetes. And then diabetes patients can struggle with delayed healing. So say the patient's being treated for periodontitis, they could come back to the dentist a few weeks later and not have healed as much as they should have done, and that can raise sort of warning signs for the patient. In terms of Crohn's, a doctor would see that as a gastrointestinal condition. It presents in the mouth as oral granulomas of sort of an odd presentation and pattern and texture in the mouth. Ulcers as well. Ulcers are quite indicative of a few different conditions, but it normally presents with other things. So in terms of herpes, we have these oral ulcers, but this was really seen in children. So children can get this thing called primary hepatic gingival stomatitis, which is this mouth full of ulcers, which if a parent sees that, they probably won't assume, it's any kind of hepatic virus, but actually it can be a big indicator that the virus is present in children. So whereas a doctor would see it as, fluid-filled blisters on the lips, the genital area, other parts of the skin. So there's really quite a few conditions. I'm going to just skip on to leukemia because I think that's, again, not known very much. It's got quite vague symptoms, presenting to a doctor, fatigue, infections, easy bleeding. I didn't know before I started the course about the effects of leukemia on the mouth. The persistent bleeding carries across to the oral cavity, but it can also cause gingival hyperplasia. So this is when the gums essentially swell and get very large, and this can be an oral health issue because if your gums enlarge, then your risk of having gingivitis increases because the inflammation means that plaque is more likely to stick to the teeth. So this also can be the first time a patient's aware of their leukemia if they don't know that they have it because a dentist has identified it, which is very surprising. I don't think that's something that's quite sort of common knowledge. However, it's really, really significant for the patients who experience it. And I'll just move on to HIV now. So again, HIV is something that it's not very commonly known can be identified by a dentist because we tend to think about the symptoms of HIV being very, very much on the rest of the body, fever, fatigue, rash. It's kind of got a lot of vague symptoms, which can happen when it's sort of not completely symptomatic yet. Identifying HIV as a dentist, there's oral candidiasis, which I've mentioned earlier. There's sort of white patches on the inside of the mouth. But there's also a condition which is very specific to immunosuppression, which is called oral hairy leukoplakia, which is these white corrugated lesions on the lateral edges of the tongue. And that can really say to a patient, not patient, a dentist, there is an immune problem happening here. So I'm just looking at these conditions, there is so much difference in how these professionals would identify them. But I think, on the flip side, it's so positive because, it's really hard to get a GP appointment. If you can't get a GP appointment or you don't think you need one, your dentist could still identify this disease and suggest that you do go see your GP, which is really helpful when people are struggling so much to access medical services. Okay, so kind of following on from this, both professions have a role in preventing systemic disease. So not a lot of people know about the links between oral health and some of these more widespread health conditions. But there is a very strong link between periodontal disease and cardiovascular disease. So dentists can help patients lessen their risk of developing these problems by helping them with their oral care. Whereas, a doctor would most definitely focus on things that aren't oral health because it's not, first of all, it's not really, it's a lot more dentist scope than it is for theirs. And there's so many other factors that also affect cardiovascular disease for them to focus on. For a respiratory infection, there's a condition called aspiration pneumonia, which is like an infection from breathing in something, which then, causes infection in the lung. From a medic's perspective, you'd be thinking about things like dysphagia. So dysphagia is problems with swallowing, and also like the position that the patient's sitting in. It's more common for older people who are having, problems with eating. So if you've ever seen older people having maybe softer foods or pureed foods or liquid foods, or on the flip side, having thickened liquids to prevent them from choking and then aspirating the liquid, that's to prevent things like aspiration pneumonia. And dentists have a role in this as well, because if a patient's at risk of aspiration pneumonia, then we really need to focus on their oral hygiene, because we don't want there to be an abundance of bacteria that they could, aspirate just from breathing or accidentally breathing in some saliva. So there is a responsibility for both those conditions for both professions. I'm just going to, I've only got a few slides left, so I'll try and whiz through them. Facial pain is more relevant now than perhaps ever before because of the struggle to access a dentist. So many patients will go to a doctor with facial pain, either not knowing that it's a dental problem, or knowing it's a dental problem, but not wanting to go to a dentist.
Hello, is everything okay?
Having a fire drill.
Fire drill, right. Okay, no worries. I will take over. I've got some example cases. We will talk through some interactive cases. Let me know when you can get back. If not, can you send me the slides for this? I can see if there's anything else to go through. If not, I've got some interactive cases, so I will start to present something else for now. No worries at all. Thank you so much for getting this far. And if you do get back before we've finished, feel free to take over again. Amazing. So wait, let me bring it to full screen. It's a lot of information. Right. So how are we finding things so far? What have we understood about the difference between dentistry and medicine? So what kind of things are they different in the kind of things they're focusing on, the kind of areas that they prioritize for day-to-day interactions? What have we identified? So quick recap in the chat for anyone who's getting tired, anyone who is distracted. What have we learned? Medicine more holistic, dentistry more specific, definitely, as you'd expect, because kind of dentistry, there's a specific focus on kind of oral hygiene, the mouth, the teeth, But not just that. So in dentistry, we're centered on the mouth, but we are looking at how other areas can influence the mouth and the teeth, and how the mouth and the teeth can influence other areas. So while dentistry is a little bit more oral specific, we have to remember that both of them need to be holistic. It's not possible as a dentist to just care about teeth, because just like Charlotte went through, we can see how so many different areas of the body are also influenced by oral health. So oral bacteria can cause respiratory diseases, they can contribute to heart disease, and there are loads of studies out there if you want to research. If you just searched up oral bacteria, heart disease, oral bacteria, respiratory infection, you'd find so many connections between the two. So you do have to focus on all areas of the body as a dentist, but the priority is going to be on the oral cavity. And yeah, Najiha, that's right, diabetes as well, so many different examples you can find. So, if we have some sample cases now, see what I was doing, I was looking at some of the feedback and it was like people wanted cases. Well, the good thing is I was sitting there, so I thought, why don't we get some together? Let's start with the first one. And for each of these, what I want people to do, just put up their hand and take one stance. If you're an aspiring medic, talk about this kind of stuff, maybe a future doctor might be looking at. If you're an aspiring dentist, think about what a dentist might be considering in this scenario. So can everyone see what's on my screen with Mrs. Patel, who is in mild cognitive decline? So she's got slight dementia potentially, refusing to get dentures, struggling to eat solid food, lost 6 kilograms in 3 months. Very clearly, this situation requires involvement of both medical professionals, dental professionals, social workers, so much more. But for now, imagine you are a dentist or you are a GP. What kind of things would you think about here? Just put your hand up and start sharing your thoughts. So hopefully you can see my screen.
Hi, you pause your screen.
Can you see it?
No, yeah, we can now.
And now? So we can see the whole slide, which has got all the stuff about Mrs. Patel on. You can't see it.
We can't see it now.
You can't see it. Okay. Keep looking at this then. Now you should be able to see it. Let's hear what your thoughts might be. So, anyone want to put their hand up and clarify to start with whether you're thinking from a medical angle or a dental angle? What kind of things would you consider? So please someone volunteer, otherwise what's the point of an interactive case? Patricia, thank you so much. Very brave volunteer. Let's go. Oh, and if you
Okay,
want
no
me to stop the
worries.
recording, I can. If that would make you more comfortable, I can pause the recording.
Oh yeah, sure, I don't mind.
You don't
So
mind?
as
Okay,
an
go.
Okay, thank you. So, as an aspiring medic, the first thing that caught my attention was mild cognitive decline. So, I'm thinking perhaps some sort of neurodegenerative disease. And she also says that she refuses to get dentures because she's eaten like this for years, although she struggles to eat solid food. So, even though that there could be some sort of oral issue, it could be emphasizing that she's been having some cognitive issues. Perhaps she wasn't able to eat solid food because she forgot.
Definitely, that makes a lot of sense. So, cognitive decline, one side of things you've really nicely picked up on, is she able to remember to eat? Is she able to remember to take care of herself? And so, you might be thinking about maybe a referral to social work, a referral to other agencies who can make sure she's getting support with her meals. What about the fact that she's refusing to get dentures? So, if she is in cognitive decline, what might she not have that could make it tricky for her to make decisions? So we talked about informed consent, and remember that's an important principle from the General Dental Council and the General Medical Council. What is so important about informed consent that having cognitive decline might make tricky? Yeah, lots of good answers in the chat. Capacity. So, to have capacity, to be competent, you need to be able to understand the situation, weigh up the pros and cons, retain it, remember it for long enough to make a decision, and communicate it back to the doctor. Those are your four things: understand, retain, weigh, and communicate. Now, that's in like the Mental Capacity Act. Those are the things you need. For this person who has cognitive decline, they might not be able to do that. And so this person who's refusing to get dentures, you have to make sure as a doctor, do they have capacity? Do they understand what's going on? You need to make that assessment about their current mental state of mind. Are they able to make the decision for themselves? Do they have those skills? Brilliant. So really nicely picked up on mild cognitive decline, but makes her own decisions. What we want to check, is that appropriate? Is she understanding what's going on? And are we going to maybe talk to her in simpler language? How are we going to communicate to her to make sure she understands what could potentially go wrong if you're not getting dentures? Why are they important? So that would be maybe from the medical side. What else do we have? So Emma, anything to add?
I'd say perhaps since it says that she only speaks some English, maybe seeing if we could get like a translator involved in the sessions, because perhaps some of the reasons why she's showing like she's adamantly against these treatments could be more of a language barrier, and that she's not picking up fully or being fully receptive to what's trying to be communicated to her that's for her own good, and she might just not understand it from a language viewpoint.
100%, definitely. So in this case, for both medical and dental, so this is something that's important for either scenario, you're going to have to think about the language barrier. Because whatever the concerns the dentist has, whatever the concerns the doctor has, they're going to have to communicate them with the patient, and they're going to have to talk through them. Why is the patient reluctant? Why are they maybe not keen to have dentures? What sort of things are they experiencing? To get that understood, to make sure the patient can make informed consent, you need to communicate to them in their preferred language. So interpreting is going to be a concern for both of them. If I talk about more of the things from the medical side they might be thinking about, well, in this scenario, we can see that she's struggling to eat solid food and she's lost 6 kilograms. So I'd be worried about the weight loss, what that might mean for how frail she is. And is she perhaps at risk of something like fractures if she was to fall because of, say, a deficiency of calcium and vitamin D? So I'd be worried about vitamin deficiencies. I'd be worried about the cognitive decline. I'd want to find out more about that. I'd be thinking about maybe is she experiencing depression? I would look at maybe if there's a referral needed for something like social work. Is there any way we can help with the nutrition? That's what I would think about on the medical side. On the dental side, I would think about the issues we're facing here. So, gum disease, what is the risk of gum disease? What are the potential for losing teeth? What can happen? So, you could experience bone loss, you could experience strain of the jaw joint. And we would talk about what the options are for her. So even if we're not able to give her dentures, is there maybe a partial option that's not as invasive? So minimally invasive dentistry, an important key word. Is there a less invasive option that she's maybe going to be happy to have? Is there maybe a cheaper option that she's going to be happy to have? What is the issue with affordability? And is there any kind of government support available to her that could maybe make it cheaper or easier? Is she frightened? Is there any way that we can maybe reassure her when putting in the dentures? Is there any support we can get in place? Can we have a chat with her about the kind of food she eats? Is it possible to eat softer food to reduce the damage to her teeth, to reduce the pain? So, from the dental point of view, we might be thinking about the loss of teeth, the gum disease. Are there less invasive options? For the medical point of view, we might be looking at, does she understand what's going on? Why is she not eating solid food? Is there any vitamin deficiency? So look at kind of how they're different, but also look at how they're the same. Well, they both want to make sure she's consenting. They both want to make sure she understands the language so that they can communicate their concerns. So there's the oral side and there's kind of the combined side. And in an ideal scenario, we'd have both a dentist and a doctor involved in the multidisciplinary team to be able to kind of provide support for both sides of her problem. Someone saying, good job, you can communicate in Gujarati. Genuinely, that would be quite helpful. Speaking 2 languages as a future doctor or dentist. So, what would we like to do next? Should we go back to what was happening before, or would we like to try another one of these cases? As we're getting pretty close to the end, we'll probably finish in 5 or so minutes. More cases or more slides? Let's give you a choice. Cases. Okay. Charlotte, are you here? Do you want to help with these cases?
I am here.
Hi, amazing. Right, let's pick. Okay, let's get them to vote. We've got 2 options. So you can also join in the voting. So either we've got Ahmed's family, 6-year-old, speaks again limited English, having tooth pain at night, missing school. This is option number one. Or we can talk about Sophia, a confident university student who is not happy with how her front teeth look. Which one of these cases do we want to talk about? Sophia. Okay, so I'll give you about 30 seconds to have a think about Sophia, and then put your hand up, share what you might think from a medical perspective, from a dental perspective, and then me and Charlotte will give you some feedback and advice. So I'll give you about 30 seconds to have a think about this, and make sure you let us know, would you be a GP in this scenario or would you be a dentist, and what would you consider? Yeah, Emma, let's give it a go.
I think first, since she isn't sure whether it's like a real health issue, I'd first like come up with like I'm coming from a perspective of a GP here. I'd show some empathy and I'd reassure her like, yes, when you have concerns, it's the right thing to do. It's always right to come and get it checked up. And I'd first start by giving like the basics of what I know in terms of like asking her about lifestyle. Has this always been an issue? Is this like a recent change? Is this gradually happening or if it's sudden? And see if there's any maybe like lifestyle factors that have contributed, like perhaps an increased caffeine intake with university exam stress, perhaps been neglecting brushing her teeth as much due to stress of university as well and other lifestyle factors. And if those are causes, seeing if there's any ways that we can discuss about implementing ways that could help her improve her habits or lifestyles and perhaps giving her a referral to somewhere else, like mental health support and asking about like support at home and stress management and just seeing whether we can carry out a plan to help with that and to say that if she does have any further issues, perhaps like refer her to the dentist or anything like that.
Really nice. Thank you so much. So, from the medical side, we're talking about what we want to do, and we want to validate her concerns, find out more about her lifestyle and the background. So, remember, both medics and dentists are going to be empathetic. They're both going to validate her concerns. And all of these things, either a doctor or a dentist could talk about. But if we think about what each of them might be more uniquely focused on, exactly like you said, in the GP in this scenario, may think a bit about the lifestyle factors and the circumstances surrounding how she's feeling self conscious. So we might think about, is this university student who's usually confident, why is she not smiling anymore? Is she experiencing low self esteem? Is she experiencing anxiety? Has she got some sort of body dysmorphia? And would it be helpful to refer her to mental health support, counseling, something like that? Also, a dentist, you might want to refer to a dentist, as exactly like you said. So there's the mental health angle. Anything to add, Charlotte, before we pick maybe someone to discuss the dental side of things?
I thought it was you gave a strong answer, Emma, so that's really positive. I think it was really great that you started off by validating the patient's concerns, letting them know that it's okay to seek help and that it is something that is real. And I think it was also really great that you explored sort of the context and the history, and you asked about support at home. Taking a social history is really important. It gives you, wider context of the patient, and if the more information you have, the more specific help you can provide. I think it was good that you inquired into her sort of mental health. Safeguarding is a massive part of both medicine and dentistry. I would probably say, as some sort of a further development, it's really important that if there's any mention of things like anxiety, low mood, low self-esteem, sometimes, most of the time you'd want to do sort of a safeguarding check and check, are you having any, very negative thoughts? Are you having this low mood? Perhaps thoughts of self-harm. It seems like it might be an extreme, but actually, especially if somebody's not thinking about their mental health too much, it's really important to take the opportunity while they're in a healthcare setting to just check, just put that safety net out to make sure they're okay. I probably would recommend advising to seek support from a dentist, because if you think about scope of practice, the actual problem that she needs resolving would be a dentist's responsibility. However, the mental health side of it is definitely, within a doctor's scope.
Brilliant. Right. So if we have one more volunteer, especially if you're from the dental side, that might be quite nice. But happy to take anyone who's still got their hand up. So one more, Donna, yeah, give it a go.
A dentist might also look at reassuring her and stuff, and but they would also do clinical assessment and see what the maybe what the cause of the enamel is, and whether it could be coffee, something else, and they might provide her with solutions as well, such as like teeth whitening, and for the crooked teeth, they might offer braces like clear Invisalign, um, cosmetic options to boost her confidence and see if that works.
Definitely. So it's quite likely that the dentist would firstly want to find out maybe why the teeth are becoming more and more yellow. And if they're becoming more crooked over time in an adult, that might be quite concerning. So we'd look at kind of, is this problem getting worse over time? Has it been something that's been the case since childhood? How is it affecting her? Does she have problems maybe kind of biting down? Does she have problems eating? And is the yellowing, is there a cause? Exactly like you said. So is it maybe high coffee consumption? Is it lots of sugary food? Is she brushing properly? And then, exactly like you said, if appropriate, maybe thinking about some of the cosmetic side of things, whitening, orthodontics, veneers, anything like that. So, really good points. And from a dental perspective, maybe we're looking more at the cosmetic side. From a medical perspective, exactly like we said before, maybe we're looking a little bit more at the mental health side. But the key number one take home is this patient requires support with both. The correct treatment for this patient is not just the dental side or just the medical side. And ideally, as a dentist, you want to have at least some training in the mental health side too. And as a GP, you want to have ideally at least some training in the dental side so that at least you can cross refer, you can start to offer some basic advice. And ideally, what we'd want, and what is the purpose of this talk, we would hope that over time, medicine and dentistry become more integrated so we can help to solve problems like this. So really good points, Donna. Anything to add, Charlotte, on this?
Yeah, I think again a very strong answer, and I think it's really good to consider both the staining, the yellow teeth and the crookedness. I think something that's good for everyone to be aware of is that as a dentist working in the NHS or a private dentist in the UK will not provide orthodontic treatment to teeth that need sorts of medical, not medical, but sort of dental treatment first. So if her teeth are yellow because of her diet or her oral hygiene routine, then they would endeavour to resolve that problem, and then they would move on to having the orthodontic treatment. This is something that we think about in terms of things like Invisalign, and if anybody's heard of Smile Direct Club, which we're an online retainer service, it can cause further problems for patients if you allow them to have orthodontic treatment when they're not clinically ready for it because of other issues. Because if you have patients with periodontal disease, they're on the brink of having loose teeth, and then you start to try and move their teeth, you're going to cause some real issues. But overall, yeah, strong answer, and I think they're really good considerations about whether the color is to do with poor health or just staining, because staining isn't actually detrimental, it's just aesthetically maybe displeasing.
Amazing. So great points there. We need to be making sure we're doing a thorough assessment. What is the cause? Is it just staining or is there damage? And if there is kind of underlying damage to the teeth, then we definitely don't want to be starting with orthodontics before we've kind of reduced the risk of something like periodontal disease. Brilliant. Thank you so much, Charlotte, and everyone who's participated. What we might say, because it's 7:15, I think the slides that we've missed, if it's okay with Charlotte, we could maybe send those out afterwards to the people who fill in the certificate form. We can also email you the remaining slides. So I've put in the certificate form here. Definitely fill this in for your certificate, but also we will email you a copy of the remaining slides. But hopefully that was useful, both kind of looking at the comparison between dentistry and medicine, and also some of these cases we've gone through at the end. So let's probably leave things there for now. You can leave if you need to. We might stick around to answer a couple questions. But thank you so much for getting involved. And apologies for the disruption in the middle. I'm sure you enjoyed doing this instead. We had a slight change of plans.
The joys of living in university accommodation. That's all I have to say.